think if we even cut two breaks are one of the reasons why we absolutely could not put this on social media. I think if we even cut this and put it on social media, my guess is it's going to be banned, and it will just be one more strike against us to silence our voice. I say this because the voice that you're about to hear has been silenced already on every media platform. In fact, today during testimony in Washington, Mark Zuckerberg said what this doctor was saying could get people killed. They could take a drug that could harm them. It's unbelievable what's going on. I want to introduce you to our guest, but I want to read, I want you to understand who she really is. If I look at her resume, she's a board-certified emergency physician. She graduated from the Chicago Medical School before attending Stanford University Law School. So she's a doctor and a lawyer. Neither are slouch jobs. Neither were slouch universities. She completed her residency in emergency medicine at Stony Brook University Hospital in New York. Dr. Gold worked in Washington, D.C. for the Surgeon General, as well as for the chairman of the Labor and Human Resources Committee. She works as a physician on the front lines, whether or not there is a pandemic. She is doing clinical work from the urban inner city to the suburban to Native American population. Her legal work focuses on policy issues relating to law and medicine. Because she was banned yesterday after she founded America's Frontline Doctors, a group that is under heavy attack, essentially just trying to help patients get information. She met with the Vice President Pence to ask for help for doctors so they can prescribe hydroxychloroquine to help COVID-19. Her name is Dr. Simone Gold. Doctor, welcome to the program.
Thank you. Thank you so much.
You're welcome. I have to commend you for your bravery and what you're doing. I know the last couple of days must have been a whirlwind and had to have shocked you. It's one thing to see it happen to other people, but when it happens to you, it's a different story, isn't it?
This has been stunning, and I was absolutely warned that it would be a firestorm, but I had no idea. I've heard guests say things like that in the past, but it's an absolutely stunning experience to live through. You know, I am a board-certified emergency physician. I like to take care of patients, and I was watching a tragedy unfold, both on the personal level, where a patient would need a medication that would help them, that the FDA says is perfectly fine and safe for 65 years. And then as an American, I'm watching people live through such a censorship and disinformation campaign that I'm watching free speech die. So I think my background as a doctor and a lawyer is really what informs me, and it makes what I'm seeing in front of me so incredibly tragic.
So you originally didn't want to come out and speak out or, be on the tip of the spear. But I know my good friend Mark Levin and his wife played a role in trying to get you to speak out. What was the turning point for you? What got you to finally say, I don't care, I have to speak out?
I want to emphasize how utterly insane it is that we're having any conversation at all about an FDA 65 years generic, a 65-year FDA-approved generic medication that's been proven safe for decades. It's so insane that I knew there was much more to it than just the drug, right? It makes no sense whatsoever. So again, I think being a doctor and a lawyer, really, I've always been very passionate about free speech. What we're living through right now, Glenn, unfortunately, we're living through not the end of free speech, but we're right in the middle. We're in the death throes of free speech. When a physician can't speak to their patient and a patient can't speak to their physician, we're seeing the collapse of our entire society. This is what it's based upon. And what do I mean? Of course, I've been censored. Of course, doctors have been censored. But the patients have also been censored because they've been given so much disinformation that they don't want to ask questions or they don't want a treatment that helps them. So they've both been censored.
So my doctor prescribed hydroxychloroquine along with other drugs for me. My whole family came down with COVID. He was using it. Get started on this flight right away because if you start early, it can actually help. But he told me he was afraid of losing his license for prescribing it. And he said, it's madness what's going on. So why is this happening? Is there a possibility nobody makes money on a generic drug that's been out for 65 years? Or is this just all about Trump? Or what is happening?
Let me walk you through this. It's very interesting for your listeners and viewers. So doctors prescribe on-label and off-label all the time. It's irrelevant to a physician. When a drug is approved on-label, for example, for pneumonia, let's say, once it's been approved by the FDA as being safe, you then can use it off-label for another use. So when COVID came around, it looked like chloroquine and hydroxychloroquine would be helpful. So we fully expected to use it off-label. All of a sudden, we were told we couldn't use it off-label anymore. The way we were told that is various governors of various states tell their state medical boards and their state pharmacy boards that a physician can't use this for off-label use. This has never happened in the history of medicine in the past. It's just shocking. There is no degree that I can use to tell you the enormity of such a statement. Like everybody else, I actually thought this had to do with President Trump, right? He says hydroxychloroquine is promising, then the media just really, poured hatred all over that drug, right? It's about the drug. It turns out I don't think it is. For about 6 to 8 weeks, that's what I thought too. Then I looked into it a little bit more closely. It turns out that hydroxychloroquine or chloroquine is over the counter in much of the world. Interestingly enough, it was over the counter in France, all right? You know when it got pulled over the counter? Let me explain. Over the counter in France, they moved it to a list 2 poisonous substance, which requires a prescription. You know when they did that, Glenn? They did that on January 13th, 2 months before President Trump breathed a word about it. You might ask, the next question is, why would they do that? And what I will say is you have to always look at who benefits when you knock out one contender, right? So hydroxychloroquine works early. To the extent that there's anything else, like remdesivir, that works late. It doesn't work nearly as well as hydroxychloroquine, and it's late. So if you knock out the early drug, there's obviously an opportunity for the late drug. January 13th, why did France pull it off the shelves? We had evidence in 2005 that chloroquine was likely to work against the COVID-19 virus. I say that because the virology journal published by the National Institute of Health showed in SARS-CoV-1, which is the precursor to SARS-CoV-2, which is what we're living through, chloroquine worked prophylactically and in early treatment. So we knew that in 2005, the director of the NIH, which published virology, was Anthony Fauci at that time. So Anthony Fauci clearly knew that chloroquine was likely to work. So my question is, if people want to say, well, we don't know if it works, which, by the way, we do know now, but even if we didn't know back then, a few months ago, that it worked, it was certainly a likely contender, because back in 2005, virology, they published that chloroquine worked for SARS-CoV-1, which is, by the way, 78% identical to SARS-CoV-2, otherwise known as COVID-19. In fact, I don't know why we call it a novel coronavirus. It's not really quite novel. It's 78% identical to SARS-CoV-1. It was predictable that it would work.
I have heard...
And by the way...
Go ahead.
There's a lot of information I have for you. A lot.
Yeah, no,
I'll just keep going.
Let me take a quick break, and then we'll give me 1 minute to break and right back. We're with Dr. Gold. You have got to be discredited. I mean, they are going to come after you like nothing I have seen. So, Dr. Gold, we have about 3.5 minutes left. I want you to pick, something that you think everybody needs to hear. And if you would consider coming on radio tomorrow, I will give you the full 3 hours just to talk. You are remarkably refreshing. So we can talk about that after the show, and join us for radio tomorrow. So what are the things that I've got a list of questions, but I would rather ask you, what is the 1 or 2 things? Yeah, go.
The most important thing for the American people is that the restriction on hydroxychloroquine is due to overall censorship in our society. When doctors are being censored from what they can say, when there's a narrative of groupthink that we have to follow, everyone in America is going to be in jeopardy. So the biggest overall issue is the censorship and the disinformation campaign. We're seeing it now aggressively with hydroxychloroquine, because if you can get access to hydroxychloroquine, you can live or you cannot be sick. So that's critical. The governors are restricting our ability to do that because they're instituting rules that stop doctors from doing it and empower pharmacists from filling our prescriptions, from doing that. So that's the concrete way we're experiencing the disinformation campaign is actually killing people. Harvey Risch, the famous Yale epidemiologist, has estimated that 100,000 Americans would be alive today, right, if we didn't have this massive disinformation campaign. The other really important thing specifically about the COVID-19 issue, if I could just say this, is that when people like Zuckerberg, which I just heard you say, said that what I was saying is potentially false information, I'd like to know where he went to medical school, all right? Because when you look at graphs all over the world, let's look at sub-Saharan Africa. Sub-Saharan Africa has the death rates, case fatality rates, like a fraction of what we have. A fraction, maybe like 1% of Western nations. This problem with COVID-19 deaths is predominantly Western European or American problem because we don't have access to chloroquine. You can get chloroquine in Latin America. You can get chloroquine in Africa. You can get chloroquine over the counter most of these places. You could get it over the counter in France and in Mexico before this whole thing started. So I'm saying, as a doctor, a person who's trying to heal patients, I would like to just give my patients hydroxychloroquine and zinc, which will save their lives, and also remove the spiderweb of fear that has overtaken Americans. We need to eliminate the spiderweb of fear. It's not the COVID-19 that's doing us in. It's a spiderweb of fear. Let's give Americans a way to say, you know what, I'm really afraid of this thing. So you know what, let me go to the pharmacy, let me just pick this up and grab it, put it in my pocket in case I need it. Other Americans who aren't as panicked over it can just go about their lives. Either way, both groups can go about their lives. I implore President Trump, it has gotten so bad, so dangerous, please, let's make this over the counter or let's make it on-label usage at the very least.
I beg of you to be on the radio with me tomorrow. I will give you as much time as you need, a voice that needs to be heard. Thank you very much. Back in just a minute.
Thank you.
Because the media is lying, people are dying. Because the media is lying, they are not getting the medicine that they need. Because the media is lying, our children are not going to school. This will cause abuse and death. It must stop. Join me on radio tomorrow.